We can.
Okay, so it's my great pleasure to welcome James back to Winnipeg because it's not your first visit. Despite having been here, he's back, which is a good sign. So yes, it's my great pleasure to introduce James Watmough, who most of you who have done any epidemiology must know the name of. We just saw that Pauline is also connected. So if you've done any mathematical epidemiology, you probably have read his and Pauline's paper. So James is here to talk about small heterogeneous populations. And yeah, without any...
Walk. Well, you're going to disappear.
No, I think you're fine.
Yeah. If I disappear, it's because I tripped over these things.
No, you're all good.
Okay, thanks, Julian. So yeah, it's good to be here, just to get a quick boost of my cold weather immunity, I guess, before I go back to Fredericton. And lost my picture there, so I have to look here. Yeah, so I was going to talk, I think in the abstract I promised to talk about a variety of models, and I think in the end I won't actually mention any models. It'll kind of be model agnostic, because I'm kind of curious about this business of different structures and sizes of communities and how that matters for disease transmission and whether or not we even really need to worry about it, right? And to what extent. And so some of this is motivated, I guess I should say, so these little logos are logos I've had on talks for a while, funders, mainly through the pandemic, and I think they are pretty much, except for ARMS, the Atlantic Association for Research in Mathematical Sciences, they're all no longer funding this type of research, right? So all the funding's dried up, so that's the other, this is a talk hopefully will encourage everybody to keep doing modeling of pandemic and pandemic preparedness, even though there's no more funding for it, right? We'll see. And I think I cannot change pages. Oh, because I have the focus on the wrong thing there. Zoom has taken over my keyboard. It's weird. Uh-oh.
Something happened.
It did?
You...
Have to find my... There. Okay. Yeah, and so the other piece, so want to advertise, so out east, we have the Atlantic Center for Research in Mathematical Sciences, ARMS, which is the sort of, I guess, the organizational equivalent of PIMS here, right? And so through the PIMS has a collaborative research group still, yeah, fun, and yeah, and Amy Herperd out at Memorial has set up a collaborative research group for essentially disease modeling in Atlantic Canada, right? So I just want to advertise that. And there's the website there. I think we might be still having openings for applications for postdocs and students. I'm not sure. Might be too late. Yeah, and so essentially the problem I've been playing with lately, been interested in at least. So pathogens, they spread pathogens, and I'm thinking mainly here respiratory infections, because the interesting ones now are still, well, coronavirus, because it's spiking again, and influenza, because we're getting into that season, right? And measles, interestingly enough, right? So there's probably the three main respiratory infections that I'm thinking about throughout this talk, but generally about pathogens spreading across a landscape. So that landscape is really a landscape made up of hosts, right? It's a bit spatial because in order to transmit these viruses, you do, what did I say? It requires a certain amount of hosts to be nearby, same space, roughly the same time, right? Depending on the infection. So there's a certain amount of intimacy, right? The more, in at least in a sense, to the mix, in a sense, relative to the pathogen, more intimate encounters, right, lead to a higher likelihood of transmission, right? Encounters where you're outside passing might not lead to as much transmission, unless I suppose it's outside here where it's 20 below and the pathogens can survive a long time in the air, right? Who knows? And so this is a heterogeneous landscape because temperature, humidity, airflow, all these things matter, right? So depending on the room you're in, whether it's a house with tight insulation and poor air circulation where, you know, humidity, whatnot, or whether it's a well-ventilated room, right? All these things matter. The host immune state makes a difference, right? Whether you've been vaccinated, how long ago you've been vaccinated, whether it wanes, how long ago you were infected, is there any cross immunity? Really, so back in the, when I first got started in disease modeling, when I was doing postdoc with Pauline, wasn't too long after that, we started looking at influenza because there were, well, pandemics and outbreaks. And of course, the big question to me there was, how much cross immunity is there, right? And you kind of need to know a bit about that, I guess, to think about who's susceptible, how susceptible are they, right? And then there's host health and behavior, right? Whether you've got comorbidities, we use age as a surrogate for a lot of things for just resistance to disease, I suppose. And then host behavior, whether you have behaviors that are conductive to spread of the organism, pathogen or not, right? So all this stuff matters. This is a heterogeneous landscape we're going across. And I think it's kind of, I think the right word, like maybe depending on what you've been reading and which literature you're looking at, there's kind of a multi-level network, right? Your hosts are connected through a network based on social interactions, physical proximity, whatnot, but you have different degrees of connections. You have family groups, you have social groups, workplaces, gatherings like this, right, where we can transmit pathogens to each other. And so all these, you've got kind of a multi-level network structure, right, which makes things a lot of fun. And then what I won't talk about here, but the other thing I'm interested in, especially with coronavirus, because, well, we've got this new coronavirus that went whipping through the population all over the world, what, started 5 years ago now? Almost 6 years ago, which it doesn't seem like it's that long. And as it went through, right, it changed everybody's immune state. It's no longer this pathogen our bodies have never seen before, right? But that change is, you know, what it's done to our immune systems depends a lot on when and how the pandemic went through, where we're infected, all kinds of things at the time, right? So one thing that really interests me, especially with these vaccination campaigns rolled out like in New Brunswick, we're all kind of vaccinated at once. We all kind of lose our immunity at once. Is that going to set up interesting little patterns? Or this pathogen went through and infected a household or a social group all at the same time. Are we all going to go through our loss of immunity at kind of the same time, and the entire social group sort of be susceptible again at the same time, right? And does any of that really matter, or can we just use simple SIR models and not worry about, right? So yeah, this is kind of interesting to me that the pathogen changes the landscape it's going over, and it's how it goes over that landscape is directed somewhat by the landscape, right? So it's kind of an interesting little feedback thing there that I will probably never really get around to researching properly, but it's fun. Yeah, so back in, I think I started playing around with this in 2016. or maybe a little bit earlier, just playing around with making up networks to run simple models on. And at that time, I was interested in the household, school, workplace, right? Because I was mainly interested in looking at multi-group models, simple multi-group models, and seeing how well they held up against the network models. So I was playing with all kinds of things, but this seems relevant again. So your within community structure is, well, definitely household structure, right? So these little green things are supposed to represent households of different sizes. And the green links would be connections within a household. So these connections are directed because you have two different people. The probability of transmission between those people is probably different depending on which one of them is infected, right, with the pathogen, right, and which one is being infected. So these links would be what, directed, weighted links of some sort in this graph, right? So the different colors, in some sense, I suppose, represent different strengths of connections within the different groups, different layers of the network, right? And so what I'm interested in this talk, especially, is that these make up these layers of a network like that of connections make up your community, right? And so presumably, well, not presumably, we know that the way, the speed, and all kinds of things about the transmission and infections within that graph depend on all these structures, right? And depend on the heterogeneities. And so that means that this should matter for disease transmission in a community, right? And I'll give some examples. I'll try to not get sidetracked into talking a whole bunch of that until I show some examples. Otherwise, I'll never get to some of these examples. But then we also have this within community thing connected to other communities, right? So communities are linked together. Interesting. It looks like I may have not updated my PDF slides. I did some mucking about. So we'll see. We'll see what these slides actually turn out to be. Yeah, so, and this, I think, this within community, between community, that's what is of interest in a lot of the questions for modeling, I guess, that I ran into out east. Because you have communities that are isolated, right? Where these connections between communities are easy to control from a management perspective. And I'll show you some pictures, graphs of just the coronavirus outbreak and how it was different in Manitoba, Ontario, and Atlantic provinces. I think I just used New Brunswick. But essentially in the Atlantic provinces, we had this bubble, and I didn't think it was a good idea at the time. I didn't think it would work. Even after it was done, I didn't think it would work. But we basically closed the borders, right? Which doesn't mean all traffic across the border stops. It just means non-essential travel stopped. But we do have, I was going to put some slides about this in, and I actually forgot. We had like a town called Campbellton that a colleague, Sanjeev Shira, was doing research on there, making some nice little models. It's basically a town that has 1 foot in Quebec and 1 foot in New Brunswick connected by a bridge, right? It really, you can't really close it off and shut down traffic across that bridge because there's too many connections, right? So I think the numbers I saw was that the amount of traffic going across the border dropped by about a factor of 2, right? Dropped 50%. But it's just that controlling that actually seemed to keep. It meant that New Brunswick Atlantic Canada could open up and not have too many restrictions inside the province, as long as we kept control of what was going across the border, right? Yeah, and so I don't think that worked anywhere west of the Atlantic provinces, actually. Really, border closures, I don't think between provinces it didn't really matter. And I'll try and explain some of that later and think some more about that. But did that switch? Oh, I put in there that was a, just in case I forgot to say that this was a weighted directed graph. I added my reminder. Yeah. Yeah, and so one thing that I was thinking about, so when Stephanie asked me to give this talk, I was trying to figure out what I should talk about, and I thought, well, we've got this research group that is, well, a collaboration, I guess, research group, some sort, through Public Health Agency of Canada, which has set up a external modeling group that probably a good chunk of everybody listening is aware of. Half the people are aware of, maybe. Essentially, the idea is to keep a connection between disease modelers, I guess, across Canada and Public Health Agency of Canada. So we're aware of what the important questions are, vice versa. But as part of that, there was this group called the Small Jurisdictions Group, which is, in some sense, an advocate for one of the reasons it got started, I guess, by, I think, Michael Lee and Lisa Canary, Amy Herford were the big ones that pushed it originally. Michael Lee, yes. If you don't know what that means, it doesn't matter. Yeah, and so this was because, at least for a good chunk of time, we have a few people doing modeling in smaller provinces, smaller communities, right? Lots of modeling being done in, well, Toronto, big places, modeling disease transmission in the big places, right? So, and the questions, I think we want to argue, the questions that need to be addressed are different in different communities, smaller communities and big communities, right? So one of the things I thought I might try and just argue and give some evidence for that, probably won't be very effective because I'm not sure it's actually true, but it should be true in some senses. But whether or not we really need the different modeling, I think I might actually model the reverse. That I'll explain what I mean in a bit. But essentially, we've got all these clusters. But one thing doesn't matter. Do we really need to put all this information in the models for the purposes of mitigation and control of disease, right? Or do the things we need to do to control the outbreaks not really depend on all those details, right? The things that we need from the modeling, right? So there's a lot of covering my butt there on what I mean. So yes, they matter. Yes, a lot of these details matter for transmission and control, but do we really need to do all that modeling, tailoring it to different places? Or can we basically get the same models to work everywhere, right? One size fits all. And yeah, so do different communities need different approaches? And I'll come back to that and see. I'm not sure I have any good conclusions about that yet. But one thing that, this struck me, when was this? So this is a, yes, Calgary Herald. I just went back and looked because I knew there was, early on in the pandemic, there was a outbreak of COVID-19 at a cargo meat packing plant, right? Near Calgary. So I just did a quick Google. Actually, there were several cases at several meat packing plants, and this article also got into the care home, right? Which was a big thing in New Brunswick. We kept transmission to a minimum and didn't need too many restrictions within the province to keep control of outbreaks. But all the outbreaks that happened hit the worst possible, most at-risk places they could, long-term care facilities. So it was not good, right? And so here we see it's these clusters, these smaller communities. The meatpacking plant was, well, really interesting, I guess, as long as you weren't working in the meatpacking plant. But this is a case, at least on one, my understanding was, it's like a one industry town, right? Not quite, but you have a community and a industry, and there was a strong connection between the two, carpooling between the two. The people who worked, a big chunk of the people who worked in the plant also, like my hometown, lived in the same community, went to the same school, right? So the structure is that there is a community that is very tightly coupled together. both home, school, workplace, right? And the meat packing plant was a cold environment, which the virus liked, right? So that means you get these, so definitely the details of the network structure matter, right? And in this case, this is where you get this big outbreak, which I think, I can't remember the percentage, but accounted for quite a large chunk of the cases early on in the pandemic, I think even in, right? It was a big spike. So yes, it really matters there, right? And so one would think that you do need to think about the structure of these networks and look at them to protect communities and cities, right? In your model. So yeah, that seems to be yes. Measles is the other nice one, and I think relevant here too. Which one is this? This is my quick little search and grabbing what I could find off of the CDC website, I think. This one. So this is the annual, right? Yeah, annual from 1985 on the far, whatever direction that is. Right, left, one of the two.
Right.
And this is 2025, right? A little blip here, a little bit of a blip in 2019. Something interesting must have happened here. I don't know. Does anybody know?
It's the end of a single vaccination dose and the passage to 2 vaccines.
Was it? Wow. Yeah, because there were changes in the vaccine in 71, right?
Yeah, the first mandatory vaccination starts in 71, and then double dose starts in 88.
88. So it took about, so actually that was, double dose started in 88, which was a big spike. Okay, so something interesting was happening, yeah. But yes, the measles was declared, US was declared measles free essentially in 2000, right? So this is essentially a nice campaign, improvements in the vaccine and a nice campaign to bring things down, right? And yeah, we get little blips, and then this is zooming into May 2023 to November to present day, right? I think last week, right? And so on that scale, this little blip here looks like something interesting happened, right? Yeah. And then looking at Canada, actually, this probably doesn't show up, but it's just off the, you just Google measles in Canada, right? And you can pick up these plots and see the numbers. And what was I saying here? Yeah, so we have a nice little incidence curve there. I think this is the week of rash onset. So this is actually from January. I think that's a 0.15. Yeah, this should be January 2024. Or maybe 2025. There's no year. Yeah, actually, this must be 2025. Yeah, so this is the measles incidence over 2025, right? Nice classic curve. Should be able to model that with just about anything you want, right? Yeah, no problem. But in the way in here, there's the 400 cases, but there are outbreaks in small pockets, right? Small communities. So if you, and this gets to the interesting thing about you want to plug this into an SEIR model, right? What is your population that this measles is spreading through, right? Because we've got some serious heterogeneity in immunity across the country, right? In different groups. And so this is, if this is 35 or 40 million people as your population, this is just a little blip, not much, right? But what we're seeing here is lots of outbreaks going through smaller communities, right? And they're very big, right? Really. And lots of little outbreaks tacked together. And so, yes, and this one began at I think, at a wedding in New Brunswick. If I have the right story, I may not. It makes a good story, so it doesn't really matter whether it's true or not. A wedding in New Brunswick. So it was a really nice setup where low vaccination, right? Low immunity, people coming in from all over the world to a wedding, having a lot of fun. The one person who wasn't feeling very well for the whole wedding, and then dispersing, right? To Ontario, Alberta here, I think. I'm not certain, but also down across the border south and back all over, right? So of course, and dispersing to other communities, right? Smaller communities in various places, right? So yeah, so you have a nice case here where the details of this spread are really, really dependent on the structure of these social groups, right? And clusters of higher or lower vaccine uptake, right? Yeah, so this should really, really matter, right? Yeah, and then there's a question, well, the one question is, what's going to happen with all this as this goes and as immunity, vaccine uptake wanes or rises, right? What's going to happen? Definitely, I mean, there's supposed to be this herd immunity threshold for vaccine coverage for measles, right? Which is pretty high. But it's also somewhat mythical because you've got pockets that the virus is spreading through, right? So herd immunity coming from the simple SIR model where you're assuming homogeneous mixing is presumably different than diseases jumping from community to community, right? And people who are vaccinated, but maybe they're not vaccinated because the vaccine didn't take, right? Or maybe the vaccine immunity is waned, whatever, right? So yeah, anyway, so switching back to, do we need all kinds of fancy modeling for this when it comes to what do we do for disease management? Or, you know, do we really need to know all the details about these communities and the community structure in each different case to see what we should do? Or can we just say, right, you know, roughly how the disease is spreading, we've got this basic SIR model that tells us what's going to go on. Should we just do the logical thing? Whatever that might be. But then that gets me back to when I first learned about these SIR models and started playing with, I think it was influenza, right? And whenever it was, 2006, 2009, I can't remember. Dates for me are either 0 or 1, right? 0 is the date that whatever you were interested in modeling started. Time when you started your model. 1 is today. So all these years, yeah, I get mixed up on years a lot. But yeah, the basic question here is we got an SIR model, right? So we want to model that little SIRS because we think that there's some waning immunity, right? And we want to model the spread of whatever through a population. The first question that really comes up is how big is S, right? It's not your whole population. It's your mixing population, but it's also a heterogeneous population. So, you know, people who are fully vaccinated, do we really need to count them? If we're just doing an SIRS model, who's this, what population is this pathogen really spreading through? And then does it actually matter? Because you're going to be at some point estimating this coefficient here, which can soak up population size, right? So, but to me, this was the question that got me. I didn't know what to use for S with population size when I started playing with these models. It seemed to me that I couldn't just use 45 million people for Canada or whatever the population is, right? But what do you use, right? Yeah, and so, yeah, so one good response is S and I and R are positive real numbers. Yeah. Which gets to another thing, right? If you're, and so this is getting to the small versus large, we can probably get away with positive real numbers in Winnipeg, right? And just, you know, because there are lots of people. In modeling something in a smaller community, can you get away with positive, just using the continuous state model, right? Or do you have to use discrete states or what's going on, right? So it's a question of what you can get away with for the questions you're trying to address, right? And yeah, but on top of that, we have waning immunity from prior infection, waning immunity from vaccination, cross immunity from related strains for influenza. I would have thought for coronavirus, but I'm not sure how much that really mattered in the last 6 years. Certainly it should matter now as we keep going through whatever this endemic coronavirus thing turns out to be. Partial immunity from primed immune system, right? From something else that primed your immune system just before you went to the wedding and actually protected you from infection, even though you weren't vaccinated or had any immunity to the measles, right? Comorbidities, all of this stuff is making you question whether you can just lump everybody into one big compartment, right? Yeah, so how heterogeneous is the immunity in the population? And one question that I'm interested in, but not really for this talk, is when the disease spreads through, right, does it reinforce some of these heterogeneities, right? There's a pocket of people who are now have been basically synchronously infected, right, with measles. Now, measles resistance lasts a long time, so this probably doesn't matter, but you think of the same thing with SARS-CoV-2 coronavirus, COVID-19, whatever you want to call it, that has like a 6-month waning immunity. If you have a group, social group that was infected all at the same time, 6 months later, they're losing their immunity all at the same time, right? So this is kind of interesting. And does the spread kind of smooth all this out, or does some of this stuff get reinforced? I'm kind of hoping it smooths everything out. It makes sense that it should smooth everything out, but yeah. Anyway, so yeah. Oh yeah, so one comment on this, see, maybe we can reverse engineer this. This is a simulation, a model, running a model with, because I was interested at some point in just a quick little question of, you have two groups, one vaccinated, one not. So you have two groups with two different levels of immunity. One's a really small group, so I took 750,000 people. Oh, that's probably because that's about what the population in New Brunswick was. And 95% were vaccine friendly, which meant they weren't averse to having a vaccine, may or may not have gotten one, it may or may not have taken, right? And the other 5% were vaccine skeptic, or just hadn't got around to being vaccinated, right? Which is a definite thing for coronavirus. Really annoyed me that we had, in New Brunswick at least, a lot of trouble getting people to get vaccinated, not because they were adverse to getting vaccinated, but they just hadn't gotten around to it, right? Until we said, okay, you can't go to the bars unless you're vaccinated. All right, everybody's vaccinated. Okay. Anyway, yeah, so it wasn't quite that extreme, but it felt like it. Yeah, and I don't know why I did this, but I had 5% vaccine coverage in the skeptical group too. There was logic to it at the time. And so this is what it kind of predicts, right? Yeah, so this population here being only 5%, that's like 150,000 people. So I guess it's still fairly big, right? But this, in the case of measles, I think this population is also structured a lot differently too, right? But yes, this curve here, can anybody guess what model I used to generate that? Just broadly speaking. I might not be able to answer because I might not be able to remember. And
SIR?
sorry?
Just typical SIR?
I think it was a multi-group SEIR compartmental ODE, right? But looking at that, the answer probably would be you can't tell because when I did these types of things with network-based models, you get kind of the same result, right? And so this does raise the question of, does it actually, for the purposes of making decisions, do we need to worry about all these details about community structure and things inside of communities, or can we just, do we get the right basic answers? I mean, yes, we do need to worry and we do need to do all this research because we do want to get better and better models, right? Anyway, so I'm still puzzling the answer about whether smaller communities need different models, right? Whether we do have to worry about that, or the modeling for Winnipeg and Toronto is the same as everywhere else, right? And so this is the one that makes, there's definitely a difference here, I think. Coronavirus, yes. COVID cases, I believe from data I just had from Johns Hopkins from 2020-21, right? Because this got the point I wanted to make. Bombing along here, and there were wave, right? That got named and numbered, right? And got studied. So 2021, early January, February 2021. I can't remember which one that was. 2021, early January. Can't remember. Late January here in Ontario, Manitoba, right, and New Brunswick, right? So you get these blips, right, that you then have to do something to control, right? Lockdowns, whatever. And then a big thing here. New Brunswick really just didn't get those, right? We closed the borders and we basically didn't have as much of a problem within the province, right? And I think there are a couple of things there. One is you close the borders and limit the flow, makes it a lot easier to track who's coming in, check up on isolation rules, makes it a lot easier in all these communities to do the contact tracing, right? And so I think it's just that together with the size of the community, size of the population, nature of the borders and the roads across the borders, which I'll talk about in a minute, we could do this, right? Whereas I don't know how effective closing borders of Manitoba would have been at blocking out these waves, right? And whether we don't like closing borders anyway, right? Looking at Julian, yes. Yeah, I don't like the closing borders. I thought that was just well, one is it's weird that you close, even in Atlantic provinces, you close the borders, but you don't really close the borders, right? You control a little bit the flow across, but there's still a lot of people going across. And these are the people that are probably most at risk too, right? People, healthcare workers, right? That have to go across the border because we have border communities that have between Maine and Quebec that have the hospital staff are living on the opposite side of the border, right? You can't close the borders and stop people moving, right? And these are also the people that are most likely to be at risk of infection, right? So I am surprised that it works, but it seemed to. Anyway, so let's look at this. New Brunswick. This little star is Fredericton, where the University of New Brunswick is, so that's where I'm from. This is Maine over here, and Quebec. Quebec must be up all over here. Oh, this little dashed line that you can probably barely see, it's probably the Quebec border, right? And so this interesting town here, Campbellton, kind of straddles the border. Nice cross-country skiing up here early on because it actually gets some good snow. Whale watching, yeah. And then I think this is probably Prince Edward Island sticking out here, right? Just for some perspective. Another province with 300,000 or so people, and a bridge and a couple of ferries. So easy to control flow on and off the island, right? Amherst, so this is Nova Scotia, right? Yeah. And I lost my scale, but I think if I put my fingers there, hopefully you can see that. I think that was a 20-kilometer scale, sort of. Right? So it's a 1.5 hour drive, Moncton. Well, unless you're a native New Brunswicker, then it's a 1 hour drive, Moncton to Fredericton. And about the same 3 hour drive up to Edmundston to the border there, right? An hour drive from Fredericton to Woodstock, where you use Woodstock Holton, which is the border into Maine, right? So the key thing is, I guess there are a few places here where you can cross over unless you happen to be canoeing down the rivers, which are the borders, right? And even then, it's not as easy as you would think to cross over because the rivers are like that if they see canoers land on the wrong shore. No. Yeah. And the other one here, yes, population, sorry, getting distracted here. Yes.
Use a mouse for Zoom.
Yeah.
Will that work?
That's for the PC here.
My mouse.
Okay.
Oh, never mind. You mean use a mouse that's actually connected to the computer?
Perfect.
Yeah.
Moving.
Yeah, so there, yeah, okay, so now where was I going? Oh yes, population in New Brunswick, 800,000, right, round up, just below 1 million. Population of Fredericton, about a tenth of that, less than a tenth. It's the third biggest city, probably. Moncton, similar, 80,000. Oh, sorry. Yeah. Fredericton, zoom, Moncton. I'm trying to move the mouse with my left hand. Yeah, it's bad. Moncton, it doesn't really matter where there are. There are three larger cities, and then down here to St. John, another one. Oops. The population is about a tenth of the population, right, in each of those three big centers, right? Those are the three biggest cities. Miramichi up there is not too far behind. I'm going to switch to this one because it's cool. There's Miramichi up there. There's 750,000 people are spread out all over, lots of sparsely connected, right? Rural area, right? Which is very different from most of the Canadian provinces, right? Which I think has a lot to do with what works for controlling infections, right? Anyway, Winnipeg, I think the scale is the same. Certainly looks like there are a lot more better connected communities. But I did not get the map that I was going to get that had all the lights at night from space. 1 million people in Manitoba?
1.5, 1.4.
So I have to be careful with numbers because I would say there is a population of 1 unit in Manitoba, right? Because you rescale everything. Yeah. So 1.5 million. How many in Winnipeg?
50.
So around half the whole population. And is the rest of the population evenly spread out? No. Yeah. So it's very different, right? Where the population is located, how things are going to spread is very different, right? So yeah, you would think that matters for disease transmission, right? And you would think that the modeling needs of Manitoba are different than the modeling needs of New Brunswick, right? And Prince Edward Island, Atlantic provinces, right? Yeah. And I think also the modeling needs of these communities, right, are different than the modeling needs of Winnipeg because they're facing different, you would think they're facing different risks, and you do have a lot of single school towns, I imagine, right? Single pub towns, single industry towns. Yeah, which, as you kind of might guess from that outbreaks in the meatpacking plants, should matter, right, for disease transmission. Anyway, and then where I grew up, I think the same scale. There's where my hometown where I grew up, which apparently has about 12,000. I think it's closer to 20,000 people now. It's getting big. And when I was growing up, you had to do a 7-hour drive by car to get to a larger community, right? So isolated, I suppose. But here we have on the coast about an hour's drive away, a little less now because they fixed up the highway. Prince Rupert, similar size, 12,000. And then you're cruising along here along the highway, right? Highway 16. It's pretty much not a lot of choice, right? To get to Houston, Smithers, 1,000, 5,000 people, right? Very small, really nice though, because it's also very cold because there's no mountains between Smithers and the Arctic Ocean, right? Interior plateau. And then you got to go all the way over here to get to Prince George, right? To get a population of, I think, still 70, under 100,000, right? Whereas BC has a population of well over 3 million, but they're not here, right? They're in Vancouver area. Yeah, so I think my point being that you would think the modeling needs of these communities being smaller, where I grew up, single high school, lots of elementary schools, middle schools, but single high school. And yes, in the 1980s, when the forestry industry had trouble, unemployment was over 30% or higher, right? So close to a single industry type town, right? So lots of substructure in there because it was all immigrants, right? For the most part. So this was lots of different communities, but lots of mixing between communities, right? So yeah, you would think you would need different modeling things here. How am I doing? I should look at a time. Oh my. Okay. Yeah, so, but my real question here is, and I think I'm going to try and end on a couple of things. One is that, so not that we don't need to do modeling of all the intricate network structure and details, but that we should really think about what modeling we need to do for particular questions, right? And the other one is I want to put in a plug for theory-driven modeling. I'll see if I can explain why. That's more just a me being whiny about all the publicity data's getting, theory's not getting enough, right? Yeah, so a difference between communities do affect disease transmission within and between communities, right? But should we care? And that, yes, we should care because we want to learn and understand what's going on, but that depends on the question you're being asked for, right? And it really is a question that we should address with modeling. But should we care for how we manage disease, any particular pathogen spreading through a population? You really got to look at how the pathogen is spread, look particularly at what control measures you can use, and then do the modeling to see if the structures that you were interested in and think should matter really do matter, right? And then if it turns out from the modeling they do, you can put in the effort to collect the data you need, right? To tell you what to do, right? But I think for a lot of things we will discover and have discovered that the SIR model did good short-term forecasting, right? Models without any knowledge of structure at all, just grinding through data, work, right? So depending on what you are after. And the other one, because this is something I seem to hit a lot. We don't have the data, so let's not put this in the model, right? Shouldn't have these parameters in the model or this mechanism in the model because we don't have the data to parameterize it, which is fair, I suppose. Why should we include these processes in the model if we don't currently have the data to deal with it, right? So this is just a whiny plug for data is not cheap, right? There's a lot of data, but data is not cheap. Data takes time and resources to collect. we're never going to have all the data we want. So there's always going to be the question. We need to, based on the question we're addressing, right? What we need to decide what data we need to collect, right? And this comes up a lot with the collaborations I do with colleagues doing coastal ecology. We have questions, we have models, what data do we need, right? And can we go get it, right? And I think that bit is, and we have the same thing here with these small versus large communities. We have questions about things we can do to control disease spread, in particular closing borders, vaccination, whatever, right? What data do we need to collect to tell us how to do that and what we should do? And I think that's a question that we need the modeling to address. And the modeling, the questions have to drive the modeling. The theories about what you believe are the processes have to be in there, whether you've got the data to collect them or not, right? Data to parameterize them or not, because you want to find out what data you need to parameterize them and whether or not it's even worth it, right? Is all these mechanisms going to matter, right? In the end, that's not a question so much for data as a question for the modeling of the theories, right? Yeah, and I can't remember if I had another slide or not. No, because I changed the order. Ha. So yeah, so that was it. That's my whiny little plug for doing theory-driven modeling, because I always hear about data-driven modeling. I like theory-driven modeling. Okay, so thank you very much for attention, and I lost track of what was going on with everybody on Zoom. Sorry, but Stephanie's in charge of that.
Thank you, James. Are there any questions or online or here?